Welcome to this week's NIB News Update.
Algernon Cargill, Director of the National Insurance Board, recently addressed the 5th Caribbean Conference on Health Financing Initiatives in Belize. During the conference, Mr. Cargill presented an overview of the Bahamas National Prescription Drug Plan.
The problem we have in the Bahamas, and similar to what my colleagues from Jamaica indicated, was that we have a prevalence of chronic diseases. And the data suggested that 1 in 3 Bahamians, or approximately 1 in every household, suffers from 1 or more chronic disease. And the challenge they faced was that there was an inadequate supply to prescription drug medication in order to manage a chronic disease. We surveyed the plans in Barbados, Trinidad, Jamaica, as far as Australia, and even the United States, in order that we can design what we call the plan that was, in our view, the best of the best, and brought all of the realities that existed in the Bahamas to the forefront. After we did that, we decided that we would take a two-pronged approach in the design and the implementation of the plan. We wanted to focus on the prevention of chronic diseases. That's the Healthy People part of the program that is about to be launched, where we focus on improving the lifestyles, as was said yesterday, in order to avoid contracting a chronic disease in the first place. But for those who already have the disease, we focus on the treatment.
Mr. Cargill said the drug plan allows Phase 1 beneficiaries to access formulary drugs at no cost.
The good thing about the plan, in our view, is that the medication and the supplies is free to all beneficiaries. And you have to only be confirmed or diagnosed as having the disease, and you're automatically entitled and eligible to see the medication free. And the target market is 32,000 persons, and so far there are 13,000 beneficiaries registered as of October the 20th. And equally as important, since the plan launched in September, we filled more than 5,000 prescriptions in the first month, which was quite remarkable in our view. We've invested over $1 million in US dollars in technology for the software to run the plan, and the adjudication and approval of the medication takes about 5 seconds. And once you swipe that card to the magnetic swipe, automatically whatever you're eligible for appears, similar to the system in Jamaica, and the pharmacies are paid for the medication they dispense. We have an approved formulary because obviously every physician will have a wish list of drugs that they would want to be included, and obviously we also want to manage costs because the majority of the budget I mentioned is focused on providing the medical drugs and supplies required to treat the chronic diseases. And we came up with over 160 drugs. Some diseases have as much as 16 or 17 drugs, where the physician can choose which drug combination works best for his or her patient. There's, of course, a mixture of brand and generic drugs. And we have a monthly maximum assigned for each drug. The Bahamas is a very small country. It's the geographic distribution. It's probably equivalent to the Eastern Caribbean islands. So in New Providence, the main island, which is only 21 miles long, we have 27 private pharmacy outlets, which we're excited about, where the beneficiaries can go and fill their prescriptions. In Grand Bahama, which is the second largest island, there are 4 private pharmacy outlets, and all are members of the plan. Abaco, there are 2. In Luther and Zuma Long Island, there's 1 each. But equally as important, all public outlets are dispensing pharmacies under the participating pharmacies, and there are 70 facilities. So all in all, there are over 100 outlets where beneficiaries can go. And what we wanted to do was to provide convenience and choice. And this is one of the reasons why we have so many outlets.
According to Mr. Cargill, Phase 2 of the drug plan will emphasize coordination of benefits.
In the second phase of the plan, when we launch Phase 2, we're going to aggressively pursue coordination of benefits, because in our view, if we're reducing the costs in the first instance of settlements that private insurance companies make through the direct provision of medication under the plan, there has to be a benefit to the National Insurance Board and Bahamians. So one of the things we're focusing on is not only the coordination of benefits, but in the event that the pharmacies are unable, the insurance companies are unable to coordinate benefits, we then want to focus on reducing the cost of the insurance coverage, because that's a way of providing a savings back to Bahamians, and equally as important, extending more benefits to private insurance beneficiaries.
For more information on the National Prescription Drug Plan, visit nibdrugplan.com or call 356-2070.